watching BloombergQuint. Now, as you already know, the coronavirus, going by COVID-19, that's the technical name that it's been given, has infected over 135,000 people worldwide. In India, the count is much smaller at 75, but it's early days yet. On this discussion on BloombergQuint, we're speaking to leaders in India's healthcare industry to try and understand the magnitude of the government's efforts and what the private sector can do to augment those efforts as India prepares to battle this virus. I'm joined this afternoon by Kiran Mazumdar-Shaw, the Chairman and Managing Director at Biocon, Sangita Reddy, the Joint MD at Apollo Hospitals, and Ameera, Shah, the Managing Director of Metropolis Healthcare. To all three of you, a warm welcome on the show. Ms. Shaw, if I may start first with you, the government has taken several steps, including closing our boundaries to several incoming travelers, identifying labs for testing, quarantine areas, as well as treatment facilities and isolation wards. What more needs to be done at this stage of the virus, given that we now know that the increase in the number of infected tends to be exponential?
So I want to basically start by lauding what the government has already done, because I think they have rapidly responded to the coronavirus, threat. I think unlike, countries like Italy, which were caught off their guard, I think India has taken some very good preemptive steps. I think, the way they've very quickly acted upon quarantining various aspects of this, public spaces, shutting down events and even restricting travel and restricting the ban on visitors, etc., etc. I think are steps in the right direction, because this is about containing the spread of this particular virus. And I think the world is now grappling with this threat in a very grave way. Having said that, I think we must also be in a state of preparedness, because as you said, the numbers are low at this stage. But we must be in a state of preparedness, because it could also get us off guard. And I think for that reason alone, I think we need to have the right kind of capacities in terms of preparedness, in terms of diagnostic centers, in terms of isolated wards in either hospitals or specialized nursing homes, because this is really the big challenge that countries like Italy are facing. Many of, 20% of the COVID hit cases need hospitalization. And what they are finding is that there are not enough hospital beds, not enough ICU beds. So I think from that point of view, it is extremely important for us to be in a state of preparedness. And this is something which we need to do with a sense of urgency. I think there needs to be a reach out to the private sector, including diagnostic centers. I really believe that although right now the diagnostic centers are being carried out at NIV in partnership with accredited diagnostic labs, I think the private sector can be roped in a much bigger way. We will need to screen a larger population to make sure we are ahead of this disease. The second thing is that I'm sure Sangita will talk about this, but I think hospitals also need to be prepared to actually accommodate the growing numbers that we may see. I'm just hoping that we won't, but if we do, I think we should be prepared. So those are some of my comments. And then, of course, going beyond this, I also believe that we need to make sure that in future, the government is going to be in a state of preparedness when it comes to stockpiling drugs, vaccines, and what have you. We must use this particular pandemic to do some introspection in terms of how we look at public health, how we are really looking at planning for any kind of epidemic. So I think that's where I would like to sort of end my comments for now.
I'll come back to you, Ms. Shaw, when we talk about various aspects of private sector participation. But let me go across now to both Ameera Shah and and Sangita Reddy. Ameera, let's first come to you on what role the private sector can play in testing ability. So we understand that the Union Health Ministry has made 52 labs functional for testing samples, and 57 other labs have been designated for helping in sample collection. Now that's about 110 labs. It definitely doesn't seem enough to service a population the size of India, and I imagine that the government will need to rope in the private sector, though there seems to be no commentary or discussion on that as yet. What's your take on what role the private sector can play, given that the standards around testing for this disease?
Thanks, Menaka. I think it's a very good question, and I think if you look at the data, what's happened in China and South Korea, the data is actually quite interesting and startling. So if you look at sort of the mortality rates in China, which are showing much higher than South Korea at this point, part of the reason is because South Korea went very aggressive in looking at screening and testing all people who have got any sort of symptom linked with COVID-19, and really going very aggressively in finding out who's at a very early stage of symptomatic behavior to figure out exactly who's got the coronavirus and who doesn't. This very large-scale testing has resulted in people coming into hospitals earlier, being found earlier, and therefore the mortality rate being much lower. And I think if India goes the same way, we will be in a much better shape than if we go in the other direction of delayed testing. I think this is very, very imperative. The other thing that is happening psychologically by most people is that because these are government hospitals where the labs are happening, and the rules are that if you are found with symptomatic behavior, with a fever or whatever, and you go into one of the government hospital labs, you're probably quarantined till the report comes out, and then you're sort of given instructions as to, what needs to be done next. Understandably so, because, otherwise you'll be spreading the virus without realizing you even have it. But because of this, a lot of people are therefore not voluntarily going and actually getting themselves tested because of the fear of being quarantined in a government hospital for 14 days. So if the government does partner with private players, and I would recommend this has to be done in a very selective minimum way, because at the end of the day, it's very critical that the government ensures that the testing that happens is quality. And second, that people are not taking advantage of the situation. So there are, properly price, equalization that happens. But most importantly, that the people who are found to be positive, that information goes back to the government, so the government can therefore quarantine them if necessary. So I think if the government does partner with private labs, which I would urge to happen as soon as possible as a citizen, I think this can really help us in really ramping up our efforts on the COVID-19 crisis, because diagnosis is the first step to figuring out, how we can limit this. And this has been proven in all the other situations in the other countries, so we must learn from it.
No, I understand that, Ameera, but I want to put in a quick question. Test kits, this has been a big issue of debate in the US, insufficient test kits. How are we equipped on this? I mean, we don't have any information as yet from the government. I'm hoping that we have sufficient, but right now the numbers are very low. If the private sector was to participate, what would the availability of test kits be? Can they really augment the ability of testing, the standards around this, the linkage of information, as you pointed out? How would the private sector be able to do this? Have we learned anything from previous situations, whether it was SARS or Nipah?
See, the government tried to have its own kits created in the US, and I know some other countries have tried as well, but it's too soon for them to be able to get validated kits which are created for this. So therefore, we have to use kits which are already standardized, US FDA approved, available in the world. There are about 7 companies which are producing kits for this testing and are available in India at this point. We are not aware of quantities because obviously there is a resource crunch all across the world. But with the numbers that we potentially have today, if we were to do screening, and if they engage the private sector, I believe that we probably have some capacity to be able to do this if we roll this out very, very quickly. The more we delay, obviously, as it spreads across the world, the resource crunch is going to get even stiffer, and that's going to become a second issue.
Ms. Reddy, the same question to you, but from the treatment point of view, I think so far, from what I can understand, only government hospitals or government facilities have been earmarked for isolation, quarantine, and treatment of this disease. What is the role that the private sector can play? Because if these numbers amplify very quickly, we are going to have to turn to the private sector to be able to help deal with the numbers.
So, Menaka, just a quick overview again.
Sure.
For a minute, and then I'll move to treatment.
Okay.
So if you go through the series of this is, definitely something massive on a scale that the world has never seen before. And the combination of you need first is awareness of prevention, containment, etc. So there's still further work to be done in communication, and that communication has to be multi-language. And all leaders to please be to communicate responsibly. The second thing is, the whole aspect of containment, whether it's social distancing, minimizing, work from home, canceling public programs, etc. And that's next. Then is the whole issue of screening. So then you go to testing and test screen kind of being together. And here I would add one possible area where I think the private sector can play a role, and that is even if we don't do the testing in the private sector, the ability to go to someone's home, ask them to self-contain in their home. Somebody with protective gear goes into their home. So trained phlebotomists, and this was done in the earlier crisis as well. Trained phlebotomists from the private sector go in and then take the sample to the government or any of the approved labs. That way, you will minimize the movement and contain this individual. Then the next goes to treatment, and then later this continued surveillance, which happens across all stage. So awareness, containment, screening, testing, treatment, further containment, and then surveillance. Now, I really want to once again reiterate that the government has done, a really fantastic job.
Sure.
There was a senior level meeting, the health minister, health secretary, joint secretary, large number of hospitals, diagnostic labs were all called in and, appraised of what we need to do. We're connected on a WhatsApp group. Protocols are moving and changing every day, and we're being kept aware of them. And across the private sector, everybody has identified the beds that we would give into the system for the government or begin to start treating patients. But because we have that time now, these beds are isolated. They would in no way impact our other patients. So I think the mechanism is in place if the scenario, and hopefully not, but if the scenario escalates, the private service sector, the healthcare providers are ready and capable. Now, in this whole scenario, I think the last one, which is also important, is a country as large and as smart as India, is the whole aspect of discovery. Are we playing a role in discovery of the vaccine, the virus? CCMB said something. I'm sure Kiran knows a lot more about this. And before I hand over, my very last line is really, I think, on one side, corporates are talking about containment, and corporate leadership, I think, is being very responsible. And as FICCI also, we've sent out advisories to self-contain, to do whatever we can to literally flatten the curve. Don't let this grow linearly. Let India be an example of how this has been contained. And so in the same breath, while people are saying, work from home, rediscover your, children are at home as well, things like that, I would really, request that people appreciate the health sector workers who are out there, who are committed to treating patients, who need to take protective precautions themselves, but really need a lot of appreciation. The government people right now and the private sector also is beginning, but the health sector workers must be acknowledged and appreciated in this crisis and encouraged as well.
I'll come. I want to focus this discussion a little bit more on, what citizens should do if they were to suspect that they've been infected, and how the private sector can play a role. And Ms. Reddy, to that, the follow-up question. You made 2 points. One is that you said that the private sector and a group of healthcare industry leaders are already in constant communication with the government with regards to protocol, treatment, etc. Does that mean that today, if I was suspected of infection and if my test did come in positive, God forbid, I could actually seek treatment from a private sector hospital? Because as of now, the best we understand is there are helplines that you have to call, there are government labs that you need to be tested in, and there are government facilities that you have to go for treatment. Is the private sector equipped right now and permitted by the government to also offer treatment?
So equipped right now, yes. Number of beds have been identified, names have been notified, names of the person in charge of the hospital, email IDs, phone numbers, all these are with the government. Have we been authorized right now? As of now, yet. We are not yet. We are waiting to hear more from the government on this. And here you also need to appreciate that there will be the central government authorization and the state government,
Right.
and both need to synchronize, what they're doing. But this can happen literally in minutes. The
So,
country is ready.
so what happens, Ms. Reddy, if someone who suspects that they are infected comes to one of your hospitals? Do you redirect them to a government lab, or do you quarantine them? Can you talk me through the process? Because this is information that citizens should be aware of.
So right now, if somebody comes into one of the hospitals, first everybody is being given protective. They're asked questions and they're being given hand sanitizers so that when they're not spreading further.
Sure.
From that, they're being questioned on to, what have they come for, etc. And from that area itself, if they need to be tested, we are now directed to send them to the government lab. However, the next step, which we're expecting to open up in a day or two, is that we will collect the sample and send it. The patient will be contained, or the individual will be contained either in their home or in one of the rooms which has been identified. All our hospitals have identified this so that they don't infect others, yet they are kept comfortable. So that would be the next step. Then, post having found them positive, we start planning their treatment. Is it home care? Is it containment at home or containment within the hospital? So these are the steps already being discussed with the government and will very quickly be made public.
Okay. Kiran Mazumdar-Shaw, we all agree that the government has taken quick first steps, and that is all widely appreciated. What more do both the central and state governments need to do, at quick speed to be able to rope in the private sector at this stage itself to expand testing capability and treatment capability? Because the fear is that if the numbers increase exponentially, the public healthcare system or the government-owned healthcare system will be overwhelmed within hours, if not, or within days, if not hours.
Yeah, so Menaka, I just wanted to just add to the earlier comments that yes, we don't have limitless diagnostic kits because these are now being almost rationed out throughout the world. And I believe that we have an opportunity to do some rapid screening because the biotech sector is already working towards PCR-based diagnostics, where CDC has already shared the gene sequence of the coronavirus COVID-19 virus, and based on that, it is very easy to basically set up quick diagnostic tests based on PCR methods. And through this, you can actually do some rapid screening. And if people are testing positive based on this, you can send them for confirmatory tests to the labs. So I think it's extremely important that, people showing up with coughs and colds, which may not be COVID-19, do still need to be checked. And I think these kind of efforts will go a long way in helping the government to diagnose much earlier. So I just feel that we need to look at these kind of methodologies as well, and expand the capacity in that sense.
Ma'am, if I may just interrupt you there, do we have the capability of expanding or making these, sort of first testing scenarios available across the nation, or how would this work? Would it be only select hospitals? If you can, in layman language, explain to me what, if the government were to agree to allow for this kind of pre-testing happen and rope in the private sector, could it be scaled up quickly across the country?
It can be because, you have these biotech companies in many parts of the country who can actually offer these services, and these are very rapid. So they can be turned around in a couple of hours. So any hospital, having patients who are showing symptoms can always be sort of diagnosed very quickly by sending samples to these kind of centers. And, diagnostic centers itself can also set up these systems very easily. So I think you can rapidly increase the capacity of this kind of testing. I think it's all about being in a state of preparedness.
Right.
You might never have to use it, but I really think we need to do all of this. And I think it's very important that the government and private sector really use this as an opportunity to work in a very synergistic way to build this capacity and be in a state of preparedness. Whereas Sangita described, the hospitals can do a lot, I think Ameera described that, the diagnostic centers can be partners with the government. And of course, the biotech companies can actually play a very important role in capacity building itself. And added to this, of course, is the whole aspect of treatment. And there, I think the availability of drugs is going to be very important. And I think, fortunately, there are a number of Indian companies who are already producing a number of these antiretroviral drugs. And I think this can be very important in terms of ensuring that we have the drugs in place to treat and that they're available where they are required. So I think the logistics, the supply chain, all this has to be worked out in a very effective way. Another comment I also want to make is that, we've had many epidemics in the past, and at every time we have an epidemic, we always talk about, putting controls on either exports or the fact that the Indian manufacturers must only supply to the government. These are proving to be very, very difficult for the Indian industry to deal with, because very often the government restricts, exports or sales, and they themselves don't lift the product. And the industry is left with huge inventories after the epidemic is over or contained. So I think there needs to be some understanding of what it takes for industry to be strong partners with the government, because I know that industry is still fighting for old kind of arrangements that the government had, which they have not yet honored. So I think these are some of the pain points which we must also not forget. So it's extremely important for the private sector and the government to work hand in hand and not create some knee-jerk reactions and responses to the looming threat.
Okay, we do have an export ban in place right now for certain APIs, but let me come back to the earlier point that you made about biotech testing or pre-screening, as you called it. Sorry, I'm using simple language for this. Any numbers, Ms. Shaw, that you can put to the ability to scale up across the country? Because we have no numbers right now of the number of test kits available, what can be deployed across government labs, because like I said, there are 52 and 57. What should be deployed? How will private labs, if they are roped into the effort, how will they access test kits? And if there can be pre-screening kits, in what number can they be scaled up?
See, like I told you, most of the existing kits take almost a day or two to turn around the diagnostic results. These are very rapid tests and they can be done in an hour.
Okay.
So you can see that you can have a huge capacity if you really want to do it. It's really about setting up the network. It's very easy to do that. And it's not just biotech companies who can do it. You can even set these same quick PCR-based diagnostics at any diagnostic lab. But of course, you need the capabilities and the skills of being able to do these sequencing and PCR methods, which not every lab can do. So I think from that point of view, it's again making an assessment of how many of these you need, what is the kind of capacity each one can provide. I don't have ready answers for all this, but it can certainly be scaled up very rapidly if we choose to do it and if we take a decision to allow this to happen.
Okay, fair enough. Ameera, what do you make of the suggestions that Ms. Shaw has made? That's one question. B, I also want to come to the costing of this. So has the government already started conversation with the private diagnostic industry to say, look, these are the number of kits that you might need to have. We will supply some of these or all of these. Some of these you will have to be able to source on your own. Can you talk us through any of the details if you've had in conversations with the government? Ameera?
Can you hear me?
Sorry, I missed the first part of your answer. Could you restart that?
I said, the rapid screening tests that Ms. Shaw referred to are definitely used for multiple other test parameters that we also test for. There are obviously some limitations of rapid tests, which tend to be, false positives and false negatives, which is why usually they're used for mass screening as she said, as a first level of screening.
Right.
But they can't be used for confirmatory tests, and therefore we use usually PCR sequencing for confirmatory tests. So I think there is definitely a place for both. as long as it doesn't further create confusion, because it may also happen that you may get a patient may have a false positive for a particular test or a false negative for a certain test, which could, of course, create additional confusion. So there is a way to use it in a smart, prudent way, for mass screening. So that's on that. I don't think those tests, from what I understand, are not ready yet.
Okay.
But if they are, of course, I think they would be welcome to, see how we can use them. As far as your question regarding the government and their conversations with private companies like ours, there have been conversations. They have expressed intent to want to partner, but I don't think we have still gotten to the space of the detailed logistics or the details of which kits, which are the quality standards, which are the labs. I mean, they've even state by state, there have been local efforts to identify even local sort of standardized chains to partner with. But we still have not moved to the next step of action in terms of saying that these will be the kits, these are the numbers available, the government will provide it or we will provide it. I think those are still questions that remain slightly unanswered. And of course, the faster that they're able to get their blueprint together with the details, the faster we can all move, because infrastructurally, we are ready. Whether it's the equipment, the people, as we said, whether it was the H1N1 scenario or otherwise, Zika or other virus scenarios as well, infrastructure is available with us for capacity, for people, for testing, but all we need is really government permission, alignment to really take the next steps forward, because, obviously the number of queries that are coming in daily is just alarming. Lots of people wanting to get tested to figure out exactly where they stand, who are today not getting tested at all because they're so scared of going to a government hospital.
So what are you doing to those queries that come into any of your diagnostic labs, Ameera? Are you directing them to the 52 government laboratories or the 57 labs that have been designated to do sample collection?
Absolutely. So, it's basically all government labs which have been identified for sample testing. We are redirecting people to head there. And honestly, a lot of the people are probably self-treating or deciding whether they want to do that. So I think that's the scary part in my mind.
Okay. Can I ask you as a layman, what are these two tests? I think Ms. Shaw spoke of the pre-screening test or the PCR-linked test, and what is the final COVID test? Can you just talk us through what those tests really are in simple terms so that most audiences can understand?
Sure. Basically, the test, the confirmatory test for COVID-19 is what we call as a PCR test, which is a molecular test, where we basically go down to the molecular level and gives us a confirmatory. We're able to actually count the number of viruses in the blood. So you're therefore able to get a confirmation on exactly whether the virus is in the blood or not.
Okay.
And this is a technology which is considered sort of the gold standard of testing when you're trying to find anything in virology, right? What Ms. Shaw is talking about, the rapid screening tests, are not based on a molecular technology, but they are based on pre-screening technologies, which therefore they'll give you quick results. They'll give you a result in 1 or 2 hours, but they will not give you confirmatory results. So what some labs do is, if you find common labs, like, the ones which are available on most in most cities and towns, will use rapid technologies to give quick results. But if something is found to be borderline positive, they're usually referred to a company like ours, which has the more advanced screening technologies like PCR, which will then confirm whether actually it's positive or not. Now, like I said here, the only the loophole here is if you get a false negative, right, through the rapid test. Because if you get a false negative, that means a person goes home thinking they are fine, when actually they may be a disease carrier. So that's where I'm saying we have to be prudent as to how do you use the rapid test for mass screening, and then what are the cutoffs for which you send them for confirmatory for the more advanced technology.
Okay, fair enough. Ms. Reddy, are you concerned or worried that we still don't seem to have a blueprint in place that would involve the private sector? If labs are still not very clear on things like testing protocols or when they might be brought into, the sort of the attack scenario, or when, who will pay for those kits, or how will those kits be sourced, then we are still quite a way off in being able to get the private sector to augment public healthcare.
So honestly, Menaka, I've been, in healthcare for a very long time, and I've seen, many of these, whether it was H1N1, the dengue, the MERS, SARS, each one of these. I would actually say that this level of involvement of private sector, readiness, communication from the government is the highest that we've ever seen so far.
That's great.
But also the pandemic is on a scale that we've never seen so far either. But suffice to say, I think the infrastructure, the intent of the government to partner and to work is very clear. The lab individuals who were invited to the meeting spoke primarily about playing a role in terms of collection of samples and sending it to the government labs. I think, in fact, I was planning immediately after this call, I'm going to, reach out to Ameera and to Kiran and, quickly connect them with Ms. Preeti Sudan, the health secretary, who they all know. I believe the government is willing, ready, and communicating continuously with the private sector. I think that the biggest point that we need to make right now is that individuals be careful. We don't need, foolhardy behavior on behalf of individuals. The primary containment stage, which luckily India is still in that stage, we have to follow those laws. We have to follow those golden rules.
But Ms. Reddy, if I may interrupt here, are we sure that we're in a primary containment stage? I mean, there seems to be some apprehension that the numbers that we have are simply because of the limited testing that we've done. Have we done testing on the scale that we ought to be doing for a population this size? What if there are several more undetected cases? I'm not trying to fearmonger, I'm trying to be responsible, but I'm still trying to understand whether there are several undetected cases that we simply just don't know of because either people are not being responsible enough to explain their travel history and self-report, or we just didn't not necessarily have had the systems in place to be able to do that on a mass level.
So, Menaka, obviously that's a great question, and it's a very well-educated, well-thought-out question. See, the fact is that a person is going to remain asymptomatic for 14 days before he even thinks of going for testing. The second scenario is that you do have a global shortage of testing kits. And the third is that even if you do the rapid screening, it's not going to be confirmatory. So you may be giving out false negatives. If you align these three data points, what is the best and the safest thing for a population to do is to self-isolate. So that you contain as far as possible, you create clusters. Right now, the population is a large amorphous mass. Isolations mean that those environments don't get infected, or those populations. So the safest place to be right now is a village that hasn't been anywhere near a city or anywhere near anyone who's been abroad. So that concept of self-isolation, self-containment is one of the most powerful messages we have to give out. And parallelly, we support the government, work with the government in being prepared, because God forbid if this escalates to stage 2 and 3, we have to be ready. And so these are conversations and dialogues that all responsible healthcare people have to have. And the public messaging has to be on self-containment. See, people who are being foolhardy and going out there and, saying, I'll only shake hands, I don't believe that, namaste is the solution. This is an unnecessary bravado.
No, I understand that, ma'am. That message is well taken. But I must come back to you with a question that I know will be uncomfortable to answer, but I'll ask it nonetheless. Again, I say I'm not fear-mongering, but is this 75 number believable?
So the likelihood of there being more people out there, absolutely. Because as you know, 25% of people who are infected have very simple symptoms. It's a fever, it's a dry cough.
Right.
They may be having that and being at home. And that again reiterates the point I was trying to make. That it's not only about the screening and the infrastructure and the ventilators. That stage may come. Hopefully it will not. I mean, in terms of high-end care. Right now, anyone who has the slightest sense of a cough or a fever should stay home. Anyone who's had any contact with someone who's come back from abroad should definitely stay home and self-contain for a minimum of those 14 days. And if they have a symptom, they must react. So these are the very critical messages, because there is still time for us to, like we said earlier, and what global experts all over and WHO is really, pushing, is flatten the curve. Left without these measures, the curve is a linear curve of progression. It will be a very, very high rate. If we keep doing this self-containment, you will flatten the curve, reduce the number of infected people, contain those who are infected so that they don't spread, and India will be able to handle this problem.
Yeah, I know flattening the curve has been the conversation across the board for the last week or so. I have one more question to ask you with regards to costs. Right now, it's government testing and government facilities that are doing the treatment. If God forbid, these numbers were to go up dramatically and the private sector was to get involved, how would the costs work out? Would patients have to bear the costs themselves? There is a question now on whether medical claim policies or medical insurance policies actually do cover this. I know IRDA has put out some guidance saying that they should technically be covering COVID-19. Can you give us some sense of how the costs would be managed if the private sector were to get involved?
So right now, I mean, we do know that the government has said that, please treat and we will pay. The second aspect is that insurance is covering. And I think the third aspect is that wherever possible, the private sector, as it has always done, will lend a hand. So right now, it's all about saving lives. Contain the disease, save the life. But I'm sure the government is coming out with a policy in terms of this treatment. And unless it's in ventilatory care or advanced care, which is happening to less than 20% of the people who subsequently are positive, the rest of the treatment is actually, is not going to be expensive.
Yeah, but I think there are questions about that. I don't want to get to the stage of whether do we have enough ventilators across the country, because like you said, the first effort should be to contain, otherwise any healthcare system, and we've seen this happen in developed countries as well, any healthcare system can get severely overwhelmed by the numbers or by the exponential rise. But I do want to ask this question on, can any of these facilities be scaled up in a short time? Like, are you all already talking about being able to add to infrastructure if it came to that?
So absolutely, these are the conversations we're having. We have even spoken about stopping routine care in some of the smaller units and making them 100% dedicated for this treatment, so that you contain, you don't cross-infect, and you create dedicated facilities. The private sector has said that we would lend, our support not just by allocating separate beds, but also there are 2 or 3 identified government facilities which are being underutilized. We said we would step forward and help man them. So there are lots of very active dialogues happening.
Okay, and one more question to you on the availability of medicine. Is this something that you all are concerned about at all? Like Ms. Shaw pointed out, we need to be able to step up supplies. At this point in time, do you feel assured that the government has made adequate arrangements for this, or will there need to be, augmentation there as well?
So I think clearly the government has been talking to the pharmaceutical industry. Right now, things are under control. I personally have spoken to 2 of the large pharma companies. They say they have adequate supplies for the next 3 to 6 months. If the scenario stretches further than that, then I think we have something to worry about. The bigger thing is, the hand sanitizers and the masks are truly in a shortage. All factories are stepping up their capacity in terms of production. But these are things that should be judiciously used as well. So, people who don't have symptoms wearing masks is now being declared by WHO as that you're preventing a needy person from using that mask. So some responsible behavior like that. And those who have symptoms who are using the mask, to please dispose them carefully. That's another very important aspect, because the virus is known to be living for more than 24 to 48 hours. Some are saying longer. So I think we should be hyper cautious in terms of prevention. The other big factor, which is not being spoken about enough, I think, is disinfection of homes. If you're traveling in a bus, it's smart to really take a disinfectant wipe and wipe the handles. Stainless steel is said to be carrying the virus for a longer period of time. So if you're traveling on a plane or a bus or a rail, in a train, slightly disinfecting your own area before you touch it. All these are important messages to public.
All right, final question to Ms. Shaw. Ms. Shaw, how many companies can manufacture the medication required for this, or the treatment required for this virus? Can you talk us through what the treatment is really, and whether we are currently equipped, or are you concerned that we might not have adequate supplies?
Well, I think there are a number of companies producing antiretrovirals, but as you know, as Sangita said, yes, whilst they have inventory in their estimation, which can last a few months Certainly, I think there's no cause for concern right now. But no one has an idea about, is it going to suddenly flare up or is it going to be contained? If it's going to be contained, we have nothing to worry about. If it's going to suddenly flare out beyond our expectations, then obviously it's going to pose a big challenge. But as far as availability of drugs is concerned, for the kind of estimated impact of the virus, I think we are quite okay for as Sangita said, for the next 6 months. But it's anybody's guess. I don't think we should be speculative. I just think that we need to be in a state of preparedness in every aspect, whether it is about how do we quarantine and how do we basically, prevent infected people from really infecting others. I think that's a very primary concern. Secondly, how quickly can we diagnose? I think I just wanted to correct Ameera a bit. I think when we talk about quick rapid screening, it is really a single PCR method, but it's the same PCR when you do it in a more sophisticated way, which takes a little longer time. That's the same methodology you use because it all depends on the viral load. If you have a very low viral load, it gives you a false negative. And of course, the false positives are very few if there's a high viral load. And I think the confirmatory test is really required if you feel that somebody has a symptom and yet it's showing a negative. I think you do need to have a confirmatory test. And of course, if you're using a rapid screening which is showing up if it's showing up a positive, you just want to make sure it is indeed the virus. So I think it's the same technology, but one is a sort of a less sophisticated version of the other.
Okay.
So I think this kind of discussion must be had. I think we must engage with the Ministry of Health and with the government to see how private sector can help the government to increase capacity, how the private sector can help the government to really be in a greater stage of preparedness. And I think everyone here is a stakeholder in this crisis. So I think this is what the opportunity is. And I'm sure that, we will deal with this matter, I hope, in a way that shows that we have been in a state of preparedness, that we've taken the right steps and measures. And as Sangita mentioned, let's flatten the curve. That's the most important thing.
Fair enough. To all three of you, thank you very much for joining us. I'm sure we will have several more editions of this conversation as the days pass and we have a better sense of whether we've been able to flatten the curve or not. Thank you to all three of you for joining us here on BloombergQuint, and thank you very much for watching.